1 diabetes. What is type 1 diabetes? Type 1 diabetes, also known as juvenile or insulin-dependent diabetes, is a chronic condition in which the pancreas produces little to no insulin. People sometimes only associate type 1 diabetes with childhood. However, type 1 diabetes is not just a childhood disease. It can occur at every age in people of every race and of every shape and size. Although type 1 diabetes is being researched around the clock, as of now there is no cure or even a direct cause of this disease.
How was diabetes discovered? In 1979, using radioimmunoassay technology, Solon Burson, MD, and Rosalind Yallo, PhD, developed a method for measuring insulin in the blood. They noticed that some people with diabetes still make their own insulin, and they identified them as insulin-dependent type 1 diabetes and non-insulin-dependent type 2 diabetes. The name diabetes is shortened from the word diabetes mellitus. It is derived from the Greek word diabetes, which means to siphon, which also siphon means to pass through, and mellitus comes from the Latin word mellitus, meaning honey or sweet.
What causes type 1 diabetes and can you prevent it? Typically with type 1 diabetes, the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Once a significant number of these islet cells are destroyed, the body will produce little to no insulin. Insulin production is the chemical needed to help pass glucose into our cells. Glucose is a main source of energy for the cells that make up muscles and other bodily tissues. In type 1 diabetes, there is too little insulin to let glucose into the cells, causing sugar to build up in the bloodstream. This can cause serious complications. It is not a preventable disease, but can be managed through various treatment methods.
What are the symptoms of type 1 diabetes? Symptoms are increased thirst, frequent urination, bedwetting in children who previously didn't wet the bed during the night, extreme hunger, unintended weight loss, irritability and other mood changes, fatigue and weakness, and blurred vision.
What are the risk factors of getting type 1 diabetes? Family history. Anyone with a parent or sibling with type 1 diabetes has a slightly increased risk of developing the condition. Genetics. The presence of certain genes indicates an increased risk of developing type 1 diabetes. Geography. The incidence of type 1 diabetes tends to increase as you travel away from the equator. Age. Although type 1 diabetes can appear at any age, it appears at two noticeable peaks. The first peak occurs in children between 4 and 7 years old, and the second is in children between 10 and 14 years old. So although these listed are people that have an increased chance of developing type 1 diabetes, there is still no specific cause of developing this disease.
There are many complications that can come from type 1 diabetes. They include heart and blood vessel disease, which it can increase your risk of various cardiovascular problems, including coronary artery disease, heart attack, stroke, narrowing of the arteries, and high blood pressure. Also, it can cause nerve damage. Excessive sugar can injure the walls of the tiny blood vessels that nourish your nerves, especially in the legs. This can cause tingling, numbness, pain, or burning that usually begins at the tips of the toes or fingers and gradually spreads upwards. Poorly controlled blood sugar could cause you to eventually lose all sense of feeling in the affected limbs. Kidney damage is also a complication. The kidneys contain millions of tiny blood vessel clusters that filter waste from your blood. Diabetes can damage this delicate filtering system. Severe damage can lead to kidney failure or irreversible end-stage kidney disease, which requires dialysis or a kidney transplant. Eye damage. Diabetes can damage blood vessels of the retina, potentially causing blindness. Diabetes also increases the risk of other serious vision conditions, such as cataracts or glaucoma. Foot damage. Nerve damage in the feet or poor blood flow to the feet increases the risk of various foot complications, Left untreated, cuts and blisters can become serious infections that may ultimately require foot or leg amputation. Skin and mouth conditions. Diabetes may leave you more susceptible to infections of the skin and mouth, including bacterial and fungal infections. Gum disease and dry mouth are also more likely. Pregnancy complications. When being pregnant, high blood sugar levels can get dangerous for the mother and the baby. The risk of miscarriage, stillbirth, and birth defects increase when diabetes isn't well controlled during pregnancy. For the mother, diabetes increases the risk of diabetic ketoacidosis, diabetic eye problems, and pregnancy-induced high blood pressure and preeclampsia.
How to get diagnosed with type 1 diabetes. There's several tests that doctors may use to help with diagnosis. There's the glycated hemoglobin test, a random blood sugar test, and a fasting blood sugar test. Any of these will indicate levels high or low depending on type of diabetes. If you are diagnosed with diabetes, your doctor may also run blood tests to check for autoantibodies that are common in type 1 diabetes. These tests help your doctor distinguish between type 1 and type 2 diabetes when the diagnosis is uncertain.
Treating type 1 diabetes is easy. You take insulin, run frequent blood sugar monitoring, you eat healthy foods, you exercise regularly, and you maintain a healthy weight.
How to get insulin into your body. There are two ways to inject insulin. One was a direct injection with a fine needle or syringe, and the other is through an insulin pump, which uses a catheter with a reservoir of insulin to pump into your abdomen.
There are some risks or side effects to the treatment of type 1 diabetes. The side effects of using a pump are that it can cause weight gain. It can also cause diabetic ketoacidosis if your catheter comes out and you don't get insulin for hours. It can also be very expensive. It can be bothersome since you are attached to the pump most of the time. And it can require a hospital stay or maybe a full day in outpatient care to be trained.
What are the average cost of type 1 diabetes? People diagnosed with diabetes incur average medical expenditures of $16,752 per year, of which $9,600 is attributed to diabetes. People diagnosed with diabetes on average have medical expenditures approximately 2.3 times higher than those in the absence of diabetes. Insulin prices recently have increased 2 to 3 times, causing frustrations among people battling type 1 diabetes. An example of this is the price for one vial of Humalog surged from $35 in 2001 to $234 in 2015.
The diet needed to help maintain type 1 diabetes are eating lots of fruits and vegetables, lots of whole grains, eating less animal products, and eating refined carbohydrates.
Short-term complications of type 1 diabetes. Some short-term signs and symptoms of having low blood sugar can be sweating, shakiness, hunger, dizziness, rapid or irregular heart rate, fatigue, which can lead up to, if not treated, some more serious signs of lethargy, confusion, poor coordination, and even convulsions. On the other hand, signs and symptoms of having higher blood pressure include frequent urination, increased thirst, blurred vision, fatigue, and irritability. All of these trigger signs that you should get treatment immediately.
Believe it or not, there are some famous people with type 1 diabetes. At the top of the slide, we have Halle Berry. In the middle, we have Nick Jonas. And at the bottom, we have Bret Michaels.